Pushing the Limits. Today I have an expert on thyroid. He is Dr. Eric Osansky, and he's going to be sharing his insights on Graves' disease, on Hashimoto's and hypothyroidism, and the connection between the gut, the immune system, and the brain, and the thyroid. And we do a deep dive. And this is one that really, I think, will affect a lot of people dealing with thyroid issues. So I really hope that you enjoy Dr. Eric's podcast with me today. Also, just to remind you that we have a health span hacks course that I did with Dr. Elizabeth Yurth, one of the greatest regenerative medicine specialists of all times, the founder of the Boulder Longevity Institute. And it's called Health Span Hacks, How Not to Die. And it's a short course that you can take on understanding how to take control of your health, how to read blood work, how to understand how to research, how to analyze how research is done and what's a good study and what isn't, and who to listen to and who not to listen to, and information about longevity and peptides and all sorts of things in the course. So I'd love you to go and check it out. It's on my website at lisatamati.com. Hit the Work With Me button and you'll see the Health Span Hacks course. Also, Aevum Labs, our biotech company, is now up and running, and we are super excited. Our product is running off the shelves. Our flagship product is called Rejuvenate Pro, and it is an immune product. We have spent the last 2 years in formulations and scientific research and working with teams of people around the world on this formulation. It's got over 15 years worth of clinical research behind it. It helps strengthen your immune system. As we get older, we get something called immunosenescence, which is the aging of the immune system, and it's at the core of all of the hallmarks of aging. And this formulation addresses that. If you want to dive deep into the science, go to Aevum Labs, that's AEVUM labs.co.nz, and read all about the science there. Listen to the episode that I did actually last week with Dr. Elizabeth Yurth on it. That's a deep dive into immunosenescence in general, as well as our formulation Rejuvenate. And also go over to my shop at lisatamati.com and you can buy it in my shop there at just on my main website if you hit the shop button. Okay, so those are the two things I wanted to talk to you about today. Now over to the show with Dr. Eric Osansky. Well, hey everyone, and welcome into Pushing the Limits. Today I'm super excited to have a gentleman with me who is going to be sharing his story around Graves' disease and hypothyroid and thyroid issues. And I'm really excited for this conversation because I've been looking for experts to come on the show and share their insights about the thyroid, because we have an epidemic. And I have Dr. Eric Osansky with me. Wonderful to have you, sir. Thank you for coming on and sharing your great knowledge with my audience. I'm really appreciative. So, Dr. Eric, tell us a little bit about yourself and how did you fall into the space? Because you're a chiropractor.
Yes. Yeah. And first of all, thank you. Thank you for having me, Lisa. Just it's an honor to be here. And yeah, I had my own health journey, just like most of us or a lot of us have had, especially guests of yours, and had my own low back pain journey before becoming a chiropractor. And then while being a chiropractor, I had my thyroid journey. So this goes back to 2007 when I was a little bit overweight at the time, and I made the decision, okay, I'm gonna diet, I'm gonna detox, I'm gonna exercise. I was exercising, but I'm gonna go all out. And I did that for a few months and was successful in losing weight. And little did I know some of the weight loss was due to the hyperthyroidism, but I really didn't catch on until one day I was just walking around a retail store and they had one of those automated blood pressure machines. And I took my blood pressure, which was fine, but my resting heart rate was 90. And I was thinking, well, maybe it's just because I'm walking around and just getting the heart rate up. So I wasn't like truly resting. But the next few days, I would take my heart rate resting, and it was anywhere between 90 and 110 beats per minute.
Yeah.
And that's when I realized something was wrong. And I was losing weight, but I was losing a lot of weight. Ultimately, I ended up losing 42 pounds, which I wasn't trying to lose that much weight. And yeah, and I just attributed it to the diet and exercise, and some of it probably was due to that. But I went to a primary care doctor, did some thyroid testing, very basic testing that they did, but enough to find out that I had hyperthyroidism, and eventually went to an endocrinologist, and then was diagnosed with Graves' disease, which is an autoimmune hyperthyroid condition. And Hashimoto's is a more common of the two
Mm.
autoimmune thyroid conditions, but and we could definitely talk more about that. But I didn't really know much about Graves at the time, and but as a chiropractor, we need our continuing education credits, and I always used to attend nutritional seminars. And there was a few functional endocrinology conferences I went to, and they focused more on hypothyroidism, but
Mm.
they did talk a little bit about hyperthyroidism. So when I was diagnosed with Graves, I thought back and I remembered, and they gave manuals, and thankfully I still had some of the information, and so I knew there was hope. Now I was still skeptical because I never that was the first time I was dealing with it, and I never knew anybody else with Graves who restored their health. But I figured out I have nothing to lose. There's an underlying cause of the problem, and the endocrinologist, they're just going to give medication, or in some cases they give radioactive iodine or thyroid surgery. And I'm like,
Mm.
yeah, let's just I don't want
Hi
anything to do
ho.
with those treatments, but the medication, if I had to, I would have taken it, but there were herbal remedies, and I gave the herbs a try, and they did help. And then over time, by addressing the underlying cause of the problem, changing my diet, managing my stress, taking certain supplements, I was able to normalize my thyroid, normalize my antibodies, pretty much have been in a state of remission, or some would say I've been cured. Again, I know there's a genetic component, so I just say I'm hopefully in permanent remission,
Yeah.
and been so since 2009, and since then I've been helping others with people with hyperthyroidism, as well as those with Hashimoto's as well.
Wow. So it's always interesting, when you find people that have actually it's they've had their own issue, and that's been the impetus for their own research, and then they go deep, right? Because when it's you, and you've obviously got a medical background with a chiropractic degree, but then you actually go, heck, I've got a problem, so I'm going to go deep. And now you've written two books on the subject, and
Actually, three, yeah,
three.
two on hyperthyroidism, and then yeah, one on Hashimoto's. So
One
yeah.
on Hashimoto's, yeah, the triggers for Hashimoto's. So you're a real expert in this area now, and like when we're looking at thyroid issues in general, how much of it is an autoimmune component? Like how often is it Graves or Hashimoto's, as opposed to just hypothyroidism from other causes? Because most people, I don't think, understand that it is often an autoimmune component to it.
Yeah, you're absolutely right. So, approximately 90% of
Wow.
thyroid conditions are autoimmune. So, most people with hypothyroidism have Hashimoto's, and most people with hyperthyroidism have Graves. So, there are obviously exceptions, and some that don't have that autoimmune component. But yeah, most people do. And sometimes they don't get that, especially with Hashimoto's. A lot of times they don't test the antibodies just because the
No.
treatment is the same regardless from a conventional medical standpoint.
No comment. Because I mean, like, you need to know if you have one of these things, and it should be part. Actually, let's talk about then testing, because testing is, I've had my frustrations, with the clients that I'm working with, and I have to send them to their GPs to get the actual blood test done, right? And the arguments are always like, we only need the TSH. And I'm always asking for T4, T3. Never can get a reverse T3. I have to order that through my own functional medicine portal, and TPO antibodies, and thyroglobulin. Why are they so resistant to doing a full panel, and why is it important that you get a full panel done?
Yeah, that's a great question. I mean, from the standpoint of Hashimoto's, they tip a lot of times they'll just do TSH, just because again, that's what they use. They just use the TSH. It's a pituitary hormone, and typically if the TSH is elevated, that means the thyroid hormones are low or on the lower side. And as I mentioned earlier, that the treatment doesn't make a difference if someone has the TPO and or thyroglobulin antibodies in that case. I mean, from our standpoint, it does, but if you go
Not from
to
theirs. Yeah.
yeah, for a regular medical doctor or even endocrinologist, usually it's going to be thyroid hormone replacements. With Graves, they usually will do more than just the TSH, because if the TSH is low, it could mean a few different things. I mean, it could also be if the TSH is elevated, but if usually they might not do a complete thyroid panel, but at the very least they'll do a free T4, and many times they will look at the antibodies, which in the case of Graves, it's called thyroid stimulating immunoglobulins, or TSI, which is a type of TSH receptor antibody. There's also what's called the radioactive iodine uptake test, which looks at the uptake of iodine, and sometimes they will use that. I'm not a big fan of that test. I'd rather, even though it only involves a small dose of radioactive iodine, still I'd rather no
Not.
exposure to radioactive iodine. And if someone gets the antibodies and they're positive, then it's pretty much diagnostic of Graves, especially in the presence of hyperthyroidism. So, but yeah, well, getting back to Hashimoto's, I mean, really in both cases, you want to do, as you mentioned, you want to not only look at TSH, you want to look at the thyroid hormones. So free T3, free T4, those are the free hormones, and T3 is important because it actually binds to the receptor. So a lot of times, yeah, many times if they look at the hormones, they'll only look at T4 and not T3. So yeah, you definitely want to look at both, and then there's reverse T3, which reverse T or T3 is the active form of thyroid hormone. Reverse T3 is the inactive form of thyroxine, or T4. So that again, there's a little bit of controversy of what it does, but it seems like it blocks the action of thyroid hormone. It's a protective mechanism.
Yeah.
And again, and those with Hashimoto's, I think it's important to do reverse T3. Hyperthyroidism, usually it's going to be elevated. It's going to be reverse T3 will be high. So honestly, with hyperthyroidism, I don't test for it because it's not really going to make a difference. I know it's going to be elevated because it makes sense. If you have too much thyroid hormone, the body's going to want to try to do everything it can to like block the entry of thyroid hormone into the cell. And then, yeah, those antibodies, we do want to know if it's autoimmune, because from a functional medicine standpoint, we want to do things to reverse the autoimmune components, which I mean is, again, it's possible, but it's not. Again, I don't want to make it sound like it's easy, but I had it done. I've worked with a lot of people where we're able to reverse the autoimmune component, normalize those antibodies. Again, it can be challenging at times, but again, if you have one autoimmune condition, you're at greater risk of developing other autoimmune conditions in the future. So even if it's not easy to lower the thyroid antibodies, you still want to try to do everything you can to optimize a person's immune system to prevent other health conditions from developing.
There's this gold right there, because I think, you've just touched on it. You want to look at a system-wide situation that the body's in and see, why is this happening? So going to the root cause, going and looking at, okay, we've got an autoimmune disease here. Autoimmune, for those listening, is when your body starts to attack its own organs for some reason. That could be because of something like gluten, which we can talk about later, whether you believe that gluten is a trigger for autoimmunity in relation to thyroid, or toxins, or there are a myriad of things, stress, a shock event in life, or things like that can trigger these events that cause autoimmunity. But you made a really good point that once you have one autoimmune disease, you are at risk for having more autoimmune. So it's not just about dealing with the thyroid and approaching it from a medication point of view on the thyroid itself, but looking at the underlying cause, because there may be other things brewing, and we need to understand what's going on in the body and attacking it if it is an autoimmune disease, what can we do to support the immune system? I'm big. I've just released a formulation. I have a company called Aevum Labs, and we have an immune formulation that, after years of researching or realizing that immunosenescence, the aging of the immune system, is at the core of all of the aging diseases, that all the 12 hallmarks of aging are influenced by the state of your immune system. And if we can go after the immune system, then we can affect all these things downstream. And once again, with the thyroid, that is the case. So we want to be working on the immune system. What is then also the connection to the gut? Why do people who have gut issues often have thyroid issues?
Yeah, there's a few different reasons, a few ways in which the gut connects to the thyroid. So, first of all, again, just a reminder, most conditions, as we mentioned, are autoimmune. So most of the immune system cells are located in the gut. So anywhere from like 70 to
Yep.
80% of the immune cells are located in the gut. So that alone tells you that having a healthy gut is important for having a healthy immune system. But then there's also what's called the triad of autoimmunity, which also is known as the three-legged stool of autoimmunity. And according to this triad, there are three components necessary for autoimmunity to develop. There's that genetic predisposition,
Mm-hmm.
then there's exposure to one or more environmental triggers, and then there's that increase in intestinal permeability, which is the medical
Yes.
term for a leaky gut. And
Yes.
so there's nothing you could do for the genetics. I mean, you could change by changing diet, lifestyle, you could change the expression of genes, but you're not going to change your genes. But the good news is by finding, removing triggers and healing the gut, you can again reverse that autoimmune component. So that's another way that addressing that leaky gut can help to reverse that autoimmune component. And since most thyroid conditions are autoimmune, helping to restore the health of the gut is at least a factor. It doesn't mean that if you heal the gut alone, it's going to help to heal your thyroid, but it's definitely an important piece of the puzzle. And I think it's safe to say that if you have a compromised gut, it really is difficult, if not impossible, to heal the thyroid or really any
Yes.
autoimmune condition.
Yeah, yeah, because leaky gut is, and it's so many people with leaky gut of some degree, like we can do microbiome testing and test your things like your zonulin levels and things, and see whether you have a leaky gut. And leaky gut is when you let in tight junctions, for those listening, the tight junctions in your gut start to pull apart basically, and you get pathogens and viruses and food particles that are undigested and all sorts of things coming through into the bloodstream where they shouldn't be and causing havoc, aging the organs, causing autoimmunity, causing all sorts of inflammatory responses. And this is the cascade that gets the whole truck moving, if you like. The whole train is rolling off the tracks when you get that. So it would make sense that we should address the gut health. And then, as you said, the immune system, 70–80% is in and around the gut because it's the soldiers to the fore, right? You've got things coming in on your food and your air and all of these. So these interfaces with the outside world are really key, that we have good junction, good barriers, good barrier health. Because if we don't, that's when they're going to get in through. And you see this, and especially in older people where their immune system is compromised, that it's very easy for these bacteria to get out of the gut and into the bloodstream and cause havoc.
Mhm.
But coming back to the Graves and the Hashimoto's story, so a lot of these processes are going on for years before you actually get to the point where you've got major issues. So like your TSH, by just measuring your TSH, without measuring your antibodies and the other T4, T3, you may be missing the whole picture of what's going on underneath the radar. You may be still subclinical. Is that a problem? So, like with diabetes, we can sort of see when you're heading towards pre-diabetes and, insulin resistance, and then we can go, whoa, you've got to put the brakes on and you've got to do some lifestyle changes and diet and things like that because you're heading towards diabetes. Is there a way to see that in thyroid when we look at the entire panel versus just the TSH?
Yeah, so you're talking a little bit about optimal versus like lab
Yeah.
reference ranges, because you're right that you don't want to wait until things go out of range.
Uh,
And I mean, you could see that even with the TSH, like the TSH, a lot of like doctors, again, they're guilty of just running the TSH. But then when they'll do the TSH, if it's within the lab range, they'll say everything's fine, even if the
mm,
TSH is like a 4, which is within most lab ranges, but it's
yeah.
above the optimal range. But then you're right. Then if you look at if people were to get a complete thyroid panel and they would look and see that maybe the T4 is getting on the lower side and the same thing, or the T3, or maybe T4 looks good and T3 is low. Maybe someone has like a conversion problem converting T4 to T3. But if you're just looking at the TSH, you wouldn't know that at all. And and then the antibodies. I mean, one can make the argument that they should test the antibodies before the TSH
Yeah,
because the antibodies develop before. I mean, that one
exactly.
develops the autoimmune component, and it could, in the case of Hashimoto's, it could take like 10, 15 years before it impacts the thyroid. And but they do it backwards. They just wait until the TSH is out of range, and like we said earlier, a lot of times they still won't look at the antibodies, but when they do, it's by that time usually
The
everything else is
damage.
already out of range. So
The damage is being done, like it's, yeah, you're sort of annihilating your thyroid because your body is attacking. So autoimmune meaning that the body is attacking its own thyroid and killing its own organ over time. And we can pick that up way earlier, but just a blood test if we were able to do that regularly. So, really pushing for those thyroid antibodies to be tested if you start having any sort of inkling that there's something going on would be a good thing to do. And then the conversion piece of the puzzle, what is it that stops some people converting their inactive, if you like, thyroid hormone, the T4, into T3, which is just basically taking an iodine molecule off? Is that correct?
yeah, well, that's the difference between T4, T3. You got that one less iodine molecule. But yeah, I mean, there could be a number of different factors that affect that conversion problem. Uh, Approximately 60% of that conversion takes place in the liver. So if you have problems with the liver, that could
Yeah.
affect the conversion. We mentioned the gut. That This is another way the gut could affect the thyroid because
Uh-huh.
20% of the conversion takes place in the gut microbiome. So again, if you have gut dysbiosis, which a lot of people, if not most people do, especially with conditions such as Graves and Hashimoto's. And again, so that will affect that conversion. Even stress, chronic stress, high cortisol. So if the body is pumping out cortisol, that could affect that conversion of T4 to T3. And again, a lot of people, unfortunately, are dealing with chronic stress. So you got that trio, the liver problems with our increased toxic burden, you got the disruptions of the gut microbiome, and that stress, that chronic stress, all three of those factors can affect the conversion of T4 to T3.
Wow. And who isn't under stress nowadays, and who has, no exposure to toxins? Nobody. And this is one of the reasons why it's far more prevalent and it's epidemic, really, than we realize. And a lot of people are just going around suffering. And because your thyroid is your gas pedal for your body, isn't it? It's like your thermostat. It's your like how much acceleration. I heard one doctor use the gas pedal as a really good analogy. It's if the gas pedal is on, then you're revving and you're going well, but you don't want it to be going too fast. You don't want the foot to the floor, which is Graves' disease, and you don't want it to have no accelerator, or otherwise you're going nowhere and your whole body is slow. You're putting on weight, your hair's not growing as fast, your skin's not turning over as fast. Every single cell in the body is affected by thyroid, isn't it? Which I think most people just think of it in terms of, oh, you put on weight easier because your metabolism's slower, but it's actually a lot more than that, isn't it?
Yeah, I mean, you're absolutely right. There are thyroid hormone receptors all over the body. And so you don't want too much, you don't want too little. I mean, definitely plays the key role in metabolism, plays a big role in, I mean, people don't think about bone density
Yeah,
too, but if you
yeah,
have,
yeah.
yeah, if you don't have enough thyroid hormone, the bone quality will be poor. If you have too much thyroid hormone, increases the bone turnover. Like in
Wow.
hyperthyroidism, you have a marker on the comprehensive metabolic panel called alkaline phosphatase, and a lot of times that's elevated. And when it's elevated, some people think it's related to the liver, and it could be, but more times than not, it's actually related to the turnover of the bone
Bone.
because it's accelerated in hyperthyroidism. And then cholesterol is also affect, like we typically see in
Mm.
hypothyroidism. We see cholesterol high, like high total cholesterol, high LDL, whereas in hyperthyroidism, it's the opposite. A lot of times we'll see lower cholesterol, lower LDL, the heart rate, of course, elevated heart rate, like I experienced, and a lot of people experience with hyperthyroidism. And again, many people with hypothyroidism, it's the opposite. It's lower heart rate, heat intolerance with Graves, coldness, and yeah. So you're right. I mean, that's a great analogy as far as you don't want to, yeah, you don't
Yeah.
want to pump out too much thyroid hormone. But again, thyroid hormone is so important that if you have too little thyroid hormone, it's also going to not be a good thing in the
So
long run.
massively affects everything. So it's
Yeah.
it's a the Goldilocks zone is what we're after. You want the
Yep.
porridge just the right temperature, so to speak. And because and it affects the way you think and how fast you are cognitively and everything. The brain, your whole body, your whole metabolism, your ability to train, your motivation, everything will be affected if you're slow or if you're fast. And if you're fast, can you explain to me, and I'm still learning this, is that the HPA axis, the hypothalamus pituitary, adrenal axis, and a lot of people have got cortisol dysregulation, whether it's gone too high or then gone too low. Often it goes high first and then low later, perhaps when you've had stressful events or illness or something. How does that affect thyroid function? Um, I'll just give you a quick anecdote from my own life. So I've had some recent issues with thyroid, and hence one of my keen interest in it, and it's mild. But when I put in T3, the active form of the thyroid, which is the one that we really want to get, to the when we get into which medications and things later. But I had a big slump at about 3 o'clock in the afternoon, like because my cortisol, because I'm under a lot of stress, um, at 3 o'clock I was just wiped out once I started on the T3. What would be the connection there? Why would that be happening, do you think?
Yeah. So look, I mean, going back to the original question with the stress, the HPA axis, and the impact of the thyroid. I mean, yeah, you're right. I mean, that was a factor with me, uh, and it was not just emotional stressors, but overtraining. I
Yeah,
was
yeah,
over
yeah. I've
exercising.
been there, done
So
that.
yeah, so in my case, actually, my adrenals were all low. Like I gave the
Yeah,
example before, where you're pumping out too much cortisol. Me, I had the
yeah,
low
me too.
cortisol, low DHEA. But yeah, when you have HPA axis dysregulation, it also dysregulates the immune system, causes a pro-inflammatory state. So that's one way. And again, we're thinking about the immune system connection. Like again, most thyroid conditions are autoimmune, but then also there's a what's called secretory IgA that
Hmm.
lines the
Yep,
mucosal surfaces of the body.
yep.
And then what secretory IgA, or when you deal with chronic stress, usually that's going to lower secretory IgA. And again, it's a protective barrier. It's
Hmm.
not it's not when you have low secretory IgA, it's not like zonulin. When zonulin's elevated, you mentioned, that's like a specific leaky gut marker. But typically when secretory IgA is low, that usually links to a leaky gut as well. And
Yep.
again, so if you have that chronic stress, it could directly dysregulate the immune system, which could set the stage for autoimmunity, or at the very least be a contributing factor. And then also affects that secretory IgA, which could affect the gut. And also we mentioned that triad of autoimmunity. So those are a couple of ways and then also there's the HPT axis. So you got the HPA axis, and then the hypothalamic pituitary thyroid axis. So again, if you have dysregulation of the HPA axis, a lot of times you'll have dysregulation of that HPT axis, because
Right.
again, it's still controlled by the pituitary, and again, the H part is that hypothalamus. So in both cases, the hypothalamus communicates with the pituitary gland, which communicates with the thyroid or adrenals. It can also communicate with your ovaries and with the gonads. So, but yeah, the stress. When I do a health history, which of course just about every practitioner does with their patients, but I mean, stress is, I'd say, probably like 80 to 90% of the people I work with circle like either high stress levels, low stress handling, or even just like telling me flat out that, or like right from the
Not,
start, that I'm pretty
yeah.
sure stress was a big factor. And but yeah, so again, the having that HPA axis dysregulation, which they used to call it adrenal fatigue, and now they're kind of getting away
Yeah,
from the
we're getting
adrenal
away from
fatigue
that.
and
Yep.
talking the HPA axis dysregulation. But either way, it's when you have the compromised adrenals that could play a big role in the development, really, of any health condition. But I mean, in the research, there's actually in the literature, they show the relationship between Graves and stress. Hashimoto's, I mean, definitely with all conditions, there's that relationship. But again, you don't see it in the literature with all these different autoimmune conditions. But in Graves, there's a few studies that actually show that link. So yeah, it's important, and you're not going to get rid of the stress. So that's the next question. Well,
Nah.
what do you do? Because I mean, we're gonna deal with stress for as long as we live, and you know the answer to this. I mean, try your best and block out time for stress management. I mean, because most people aren't taking the time to, whether it's even simply doing some deep breathing.
Yeah.
Obviously, sleep is important for healthy adrenals. So trying to get sufficient sleep, but I am a believer of like blocking out some time for mind body medicine, some quiet time on a daily basis, and trying to activate that parasympathetic nervous system. So yeah,
To-
that's there is a lot you can do. Just you got to do. It's like exercise. You got to do it. You have to have a regular routine, and you got to get into that routine, because most people, they don't get into the routine. And that's why I say start slow, and then you could gradually increase the duration every day.
Yeah, no, I mean, we can't stress how much stress actually buggers us up. It just absolutely destroys our body. But it is really hard to avoid. I mean, I know with my situation, there's no way out of it. So you've got to deal with it. So in that case, I put in, prioritize putting in good inputs, trying to have breathwork practice that's even a short breathwork practice, trying to get a little bit of time for exercise, getting out in the sunshine and being in nature and grounding and all of that sort of stuff that brings me down a level. But it doesn't, always work. It would be, because stress just keeps on coming. And when you've got someone that you're caring for 24/7, that's high needs, in my case, plus running 3 companies, it's
Yeah.
just bloody difficult, and lots of other people in similar situations. But you do what you can, and you got to put in good inputs. I'm a real big fan of that. Take your good supplements, take your good food, do that exercise, connect with nature, do what you can to get it right. But let's come back now then to a little bit talking, because we've talked about the immune connection, the gut connection, um, and how it affects the thyroid. One thing I did want to ask you when we're talking about pituitary, I work with a lot of people with brain injuries, and often the pituitary is damaged in some way through brain injuries, through the impact. Um, would it be wise, you think, that people who've had brain injuries also look at their thyroid situation? I know, like with the pituitary, when you've had a head injury, 60% of
Mhm.
people have a leaky gut within a few hours. Like it's a one to, it's a huge number. Within hours have a leaky gut from when they have a leaky brain and they have a leaky have had a brain injury. So my thoughts then when you said that would be like, wonder how it affects your thyroid, with brain injuries. Be quite
Yeah, I mean, it's a
likely.
great point. Yeah, excellent point. And I didn't know that statistic about 60% of people.
Mm,
I know there is that relationship between the blood, having a leaky blood-brain barrier, and that leaky gut. I didn't know the number was that like
yeah.
60%.
Yep.
You said
Within
hours
hours.
after.
Within hours.
Yeah,
Yep. Yep. So that's
yeah,
quite crazy statistic, isn't it? When you think how many people have brain injuries and ongoing brain injuries, and our athletes who are, rugby players and NFL and all of that sort of good stuff. How many injuries do they get in a lifetime? How many
yeah.
endocrine systems are being buggered up by that, so to speak?
Yeah,
But
it does make sense though. I mean, I've had a few experts on the podcast talking about the gut brain thyroid connection, and tying it together, and it does make sense. And then you also, I mean, based on what you said too, it makes perfect sense. to at least evaluate the thyroid gland and going beyond, not just the thyroid, because again, if you have that leaky gut, looking at the antibodies, I mean, maybe you want to also look at the gut as well. But yeah, I mean, physical trauma, mental, like stored trauma, like past traumas, like we wouldn't like, again, even that, like over the last few years, you're realizing that could play a big role in chronic health conditions, not just
Wow.
thyroid. And so yeah, I think you bring up an excellent point. If someone does have some type of concussion, I mean, that's probably not the first thing they're going to look at as the thyroid, because of course they want to take care of
The
the
brain.
trauma. Yeah.
Yeah.
But you're all right. Usually that won't get monitored. Like people won't think of the thyroid at all. But based on what you said, not only should someone look at it, but maybe look at it sooner than later. Again,
Yep.
maybe not right away, but within, if
Yeah.
anything, a
After
few
the
weeks or
acute. Yeah. If you're
yeah,
not
or
getting better,
yeah,
because there's
few
so many
weeks, few
people.
months later. Yeah.
So many people with post-concussion syndromes and things like that, traumatic brain injuries that are just ongoing. They just cannot get their body right, and they don't know what it is, and they can't pinpoint it. We're always looking at things like hormones. Looked at Dr. Mark Gordon's work and had him on the podcast, and he's an expert on hormones and brain injuries. And the pituitary is a definite thing. Like that it's like an upside down ice cream cone in the middle of your brain. When you get a shake of the brain, it's like shaking an upside down ice cream, and you know what happens with an ice cream when it's upside down, it falls off. So it's worth looking at all the endocrine system. I think your hormones, your thyroid, your gut health, all of that sort of picture to get, because we are connected. Like you might have to go to the cardiologist for your heart and the whatever doctor, the kidney doctor, the nephrologist, whatever, for the different body parts, but we are one system, which I think they forget sometimes. And we are all connected, and especially through the endocrine system, this is a very complex interdependent system. When one system goes awry, it could affect other systems. So you may put a band-aid with a medication on, say the thyroid, maybe you get L-troxin or levothyroxine T4, but that may have not addressed the fact that you've got an autoimmune disease and your gut's leaky and this has not been taken care of. What's your approach when you're working with people is to, how do you approach the whole medicine side of things? You probably can't prescribe as a chiropractor, so you probably have to refer out. Is that right? But in thinking about medications, T4, the active T3, do you see T3 not being used enough? That's what I see. I see T4 being usually put in the mix if you've got a thyroid issue, but T3 is not being looked at enough.
Yeah, I definitely agree. So yeah, those are really some good questions. So with I guess as far as the thyroid hormone goes, thyroid hormone replacement. So I agree. I mean, most people are given Synthroid, which
Yep.
is levothyroxine, pretty much synthetic T4, and usually they're not given T3, and a lot of people could benefit from T3, uh, and and some people will choose to take desiccated thyroid, which has T4, T3, also T1 and T2, which we're still learning about, and you
Yeah,
still
that's
can't test them.
interesting.
Yeah,
Yeah.
one day we might be able to look at those on a blood test too, but right now not available. I know there's more on T2, like T2 supplements to help
Mm,
with like
mm.
weight loss and stuff. But yeah, T3, you're right. I mean, if someone has that conversion problem that we spoke about earlier, the levothyroxine itself is
Not
not
gonna
going
fix
to
it.
cut it. So you and I mean, to be fair, you want to try to address the conversion problem. So the person maybe, I mean, in some cases, I mean, there's a time and place for thyroid hormone, but I also think thyroid hormone replacement is overprescribed too. Again, I'm not one that says we don't need thyroid hormone, but that again, if you address the autoimmune component, some people will still need thyroid hormone, but some people won't. But if you go to a regular endocrinologist, they're never going to address the autoimmune component. So those people are going to definitely need thyroid hormone because they're not doing anything else. But so you are right about T3 being underprescribed. Not only the United States but elsewhere too. Sounds like where you are as well
Yep,
in New Zealand.
definitely.
So
Yep.
yeah, and And then as far as, I mean, you're right, I don't have prescribing rights. So like when someone comes in, especially like again, switching to Graves, we want them to be safe while addressing the cause of the problem. If someone has a heart rate of 120 beats per minute
Mm,
and that having all these other symptoms, that could be scary and could affect the bone, not only the heart, but we mentioned the bone density. We want to do things to lower the thyroid hormones. Now, in my case, I did take an herbal approach.
mm,
I took an herb bugleweed, which is an
mm,
antithyroid herb, and then motherwort, which is kind of like a natural beta blocker. So it helps,
mm.
it focuses on the cardiovascular system, even though it does have other functions too. Like most herbs, they don't just have one function, but for the sake of Graves, for the sake of hyperthyroidism, motherwort helps with the symptoms associated with the heart rate, resting heart rate, palpitations, and but there is a time and place for antithyroid medication. Not everybody can successfully use the herbs to manage their symptoms. And so if I'm working with someone, if they're taking antithyroid medication, I'm not going to tell them to stop. Just like if someone's taking levothyroxine, I'm not going to say, well, stop taking that. Pretty much I'll try to give them guidance. Like if they're from the Graves' disease side, if they're taking thyroid anti-thyroid medication and they're not having side effects and they seem to be doing okay, I'll be like, okay, it's up to you. Like you're taking the meds. It seems like you're doing well. They might have heard my story about taking the herbs, but again, that ultimately it's up to them. If you're comfortable staying on the medication, the herbs are not addressing the cause of the problem either. They're just a natural way of managing the symptoms. So whether you're taking the herbs or you're taking the medication, we want to address the cause of the problem. And same thing now with Hashimoto's. Let's say someone comes in and they're just taking T4. Now, same thing. I'm going to say we want either way. We want to address the cause of the problem, but if we see they're still having a lot of symptoms and their T3 is on the lower side, I might say, well, you might want to go either to your regular doctor, or if you absolutely have to, a different doctor that's willing to prescribe T3 or put you on desiccated thyroid hormone, because it's going to take some time for us to fix that conversion problem. And in the meantime, we don't want you to have those symptoms. So yeah, since I can't prescribe, I have to kind of give them the guidance of
Yeah,
what to do,
same.
where potentially where to go,
Mm.
um, while trying to address the cause of the problem at the same time.
Yeah, yeah, yeah. So, but that's the important piece. Like the medications are the thing over there, and the doctors can prescribe that. We can look at that and the situation and the results from the blood tests and things. But getting to the root cause of it is probably more important. And what do you put in? So, if we look at some commonly used supplements now for, say, Hashimoto's or hypothyroidism, from a diet and supplement point of view, what are some of the common things that you would be looking at there?
Yeah, well, diet wise, I mean, as we both know, if you get 10 different practitioners, 10 different health experts, they're all going to recommend different diets. But what they'll have in common is to eat whole, healthy foods. You mentioned like gluten earlier, so most will
Yes.
agree. Let's
Yep.
avoid the gluten. I usually say let's take a break from the dairy. Let's like try
Yep.
to take a break from common allergens, at least while healing. I mean, dairy, some people do really well with like raw dairy and other healthier forms. And I still say let's take a break while healing just to play it safe. And then you could always maybe reintroduce like the raw dairy. But so whole foods, healthy foods, avoiding refined foods and refined sugars, unhealthy oils, trying to stick with like
Okay.
coconut oil, avocado oil, olive oil, and trying to avoid like sunflower oil, safflower oil, canola oil,
Yeah,
and
definitely.
yeah. So
100.
exactly. So yeah, like I said, most practitioners will agree with the basics of the foundations when it comes to diet. I mean, there are some things like nightshades, which are a little bit more controversial. Like I do recommend for people with Graves and Hashimoto's to avoid, again, taking a break, not permanently, but from things like tomatoes, eggplant, peppers, white potatoes, because they have compounds that in some people can be inflammatory. Now, they're not inflammatory in everybody, but it almost serves like an elimination diet. Well, I'd rather someone take a break from those foods and
See how they go.
not
Yep.
hit any roadblocks than then go 3 months and then they're not healing. And then we look back and say, why don't you eliminate the nightshades then? So, and yeah, I talk more about that in my books as far as specifics with the diets and also on the podcast. But supplement wise, I mean, there are basic supplements that I recommend, and then there are some supplements I recommend depending on like the testing that I do. Like if someone has adrenal imbalances, or if someone has something going on with the gut, I might give something more specific. But I mean, the basics, I find most people are deficient in omega-3 fatty
Yeah.
acids.
Yeah.
So I
100.
do
Yeah.
recommend, yeah, like an omega-3, like a fish oil, for example. And I do recommend that. Some like probiotics, some don't like probiotics. I like probiotics. I mean, I do think you want to try to get as much through the food too. So if someone's willing to eat fermented foods, it's just that a lot of people aren't willing to eat fermented foods, at least not enough that really makes a big difference. They might have like a few times a week, if that. But again, I do like probiotics to support the
Yeah.
gut microbiome. Vitamin D, a lot of
Yeah,
people
that's the
deficient in
key.
vitamin
Yeah.
D. And yeah, and sunlight, you mentioned sunlight. I mean, I try to get sunlight. You want to try to get as much sunlight that could help with vitamin D. I still find most people do need
Yeah.
supplementation. I don't know if you find that
Totally,
the
totally.
same thing. Yeah.
Everybody's deficient when I measure them, and what is optimal for vitamin D is, like the 30 to 110, I think is the range here. And 30 is really not going to cut it. You want to be up in 80, 90, 100, 110, somewhere in the upper end of the range, really, for immune system. And vitamin D does over 700 things in the body. Like, it's just absolutely crucial. And it's really crucial for bone density, and it's really crucial for the thyroid, and for your immune system in general. So really something to be checking. I like to check always what
Yes.
the vitamin D levels are, and I like to look at things like, magnesium levels. They're also really crucial,
Hmm.
and your B12s and your B9s and things like that. But and
And
fish oils, yeah. Sorry,
yeah,
carry on.
I was gonna say selenium's a big one in
Oh
the
yeah,
world of thyroid health too. Just it could not only affect thyroid directly, but as I'm sure you know, it's a precursor to, or a cofactor for glutathione, which is the master antioxidant. So selenium, there's a lot of studies related to thyroid health and helping with thyroid antibodies. So yeah, selenium's again, you want to try to get as much through food, but the problem with food is you don't know how much you're getting. So like when
no,
someone's healing, I usually recommend selenium
same.
supplementation. And when someone's in a wellness state, like I don't take selenium supplements currently. I do rely more on food sources, whether it's Brazil nuts or sardines are a good source. But while healing, I do recommend supplementation. It sounded like you were going to say something else with the fish oils.
Yeah, so fish oils, I'm a big fan of good quality. Make sure the quality is good, right?
Yeah,
There's really important that you don't get oxidized fish oils, which, if you're getting them cheap ones
great.
from the supermarket, probably not a good idea. Pay for a quality fish oil. Or I'm a big fan of plasmalogens. Have you seen the work of Dr. Day and Goodnow? They're a particular type of fat that's in the membranes, and there's omega-9s and there's omega-3 types of plasmalogens. But I'd encourage you to go and look at his work. He is amazing, and he's reversing Alzheimer's and Parkinson's, and I mean reversing, like, don't say that lightly. Autism, neurodegeneration. I have those going in with my mum with her brain issues and increasing brain volume. Anyway, go and have a look at Dr. Dayan Goodenow, Dayan. I'm doing his certification in the plasmalogens and understanding all the fats in the membranes and how they work and how important they are. So I am a big fan of fish oils, but I'm also a big fan of plasmalogens. Unfortunately, they're quite expensive to buy.
Are those the same, or they're different than the SPMs, or
No, different, very different.
okay,
There's two. There's one called Glia Neuro. I'll send you a couple of podcasts to listen to on that, because it's something to put on as many people's radars as I can. And it's not to replace omega-3s. I think omega-3s are really important, but there is an omega-3 plasmalogen that is even way better. Way better.
hmm.
So yeah, something to put on your radar. Also, in acetylcysteine, are you a fan of that? Like, supporting in the glutathione pathway, precursor to glutathione. I'm sort of always use NAC
I
in these
do.
cases.
Yeah.
Yep,
Yep, I
yep.
commonly recommend NAC. I think it's great. not too expensive compared to some
No.
other supplements.
Yeah.
So yeah, I do
Which is
like NAC.
key. Yeah, me too. And just going back to the gluten story, because gluten has proteins in it, and you might be able to explain this better, but it's a molecular mimicry. So the body thinks that gluten is the thyroid or it attacks the. Can you explain that? What happens there when people have gluten? If particularly if you have those genetic mutations in the HLA and, or celiac or any of those sorts of genetic predispositions, especially. But in regards to the thyroid, when you eat a sandwich, how is that destroying your thyroid?
Yeah, well,
Or
I
can
mean,
it?
yeah. So, I mean, you mentioned a few things there. I mean, celiac disease, obviously, that's a different type of autoimmune condition. And if so, I mean, first of all, if someone has Graves or Hashimoto's, we mentioned earlier they have an increased likelihood of having other autoimmune conditions, and that's definitely the case with celiac. So I
Yeah,
recommend if I'm working with someone and they're eating gluten, this is important. If they are eating gluten, I will recommend for them to test for celiac disease, because if you're not eating gluten, those tests will be inaccurate. You have to eat gluten to look at the antibodies. Now, if someone's not eating gluten, I'm not going to tell them go eat gluten
yeah,
to
because
get
you make
those
them very
number.
sick.
Yeah.
Yeah.
So I'm not, I won't do that. But if someone's still eating gluten, I'll say, let's do a celiac panel. But even if they don't have celiac disease, yeah, you could have a non-celiac, um, non-celiac gluten sensitivity is what I was
Mm.
meaning to say.
Yeah,
And
yeah.
then, yeah, the molecular mimicry. So, I mean, that could happen with not just, I mean, with gluten, I mean, honestly, there's not a lot of research with that. I know if you're familiar with Dr. Datis
Yeah,
Karazian,
yeah, yeah. I
yeah, and
have.
he does talk about that, um, where it's like the amino acid sequences of gluten. I mean, we know that would certain infections like I think it's actually I think it's viruses, like where the amino acid sequence of certain infections resemble that of the thyroid gland, and that's like
Wow.
molecular mimicry, where the body will then attack the thyroid,
Wow.
and then with gluten, apparently, according to Dr. Karazian, again, this was
Mm,
years ago that he mentioned this. I don't know if he still thinks this is the
he
case, but
does. Yeah.
where also there is that similarity between gluten and the thyroid, and it's almost like, well, the immune system attacks gluten, um, and then it attacks the thyroid, kind of mistaking the thyroid for the gluten proteins. And we see again that molecular mimicry even with environmental toxins. Some toxins will bind to the thyroid, and the immune system gets confused, attacking the toxin, but then also attacking the thyroid. But yeah, getting back to gluten, regardless of the impact it has directly on the thyroid, gluten has been shown, I think it was a 2015 study showing that it increases permeability, essentially
In the
causes a
gut.
leaky gut in everybody.
Yeah.
So even if you feel great eating gluten, like if you eat gluten, like I don't feel
Nothing
bad if I
happens.
get exposed to gluten. And to me, that's not necessarily a good thing, because again, because it's having a harmful effect on everybody in some way. So when you feel bad, at least that's your body's way of telling you, hey, you should stay away from it. And if you're not feeling bad, you might think, oh, there's no problem. I could eat all the gluten I want, but
Exactly.
it is affecting that gut, your gut microbiome.
So basically, we should all avoid gluten, and it's really tough. It is really
It
tough.
is.
And the other thing is a lot of our flours and things now, the wheat that we use has been gluten enriched because it makes it nice and soft and fluffy. And you go to places like Europe where they're using older strains of wheat that hasn't been, so modified, and you
Yep.
might get away with it. I've heard that many times anecdotally, and yet when you go to the States or something, it's a disaster zone. You have anything there and you're sick. One other question that just popped into my brain when we were talking about molecular mimicry and toxins was fluoride. Fluoride in the water supply. I'm against it, dead against it. I think it's a neurotoxin. I also think
Yes.
it destroys also thyroid tissue. What's your take on the fluoride story?
Yeah, I agree. I definitely filter my water, and I use reverse osmosis to make sure getting rid
Wow.
of the fluoride, and then fluoride-free toothpaste.
Yeah, me
So
too.
I'm with you. I try to do everything I can to avoid fluoride because you mentioned it's a neurotoxin, so that's been proven. And then yeah, it definitely has a negative effect on the thyroid. I mean, all that so there's not only fluoride, but there's chlorine,
Mm,
bromide. I mean, they
yes,
all
all on the
compete with
periodic table.
iodine,
Yeah,
and so they could all disrupt thyroid function if especially in excess. But yeah, with fluoride, I'm definitely with you in trying to
yeah,
try to do your best to avoid
yeah.
exposure
And
to.
our wonderful governments just put fluoride in the water everywhere over here, and it's just, ugh.
Yeah, yeah, they've done it for
Just
years in the United States. So yeah,
yeah, we had it, and then it got taken out, and we were like, yay! And then they brought it back again, and it's just like you've got to be kidding
wow.
me. But in this day and age, when you can see the research, like it's not exactly hidden, if they would just look. But yeah, get off my
Yeah, and that's
soapbox.
and the amazing thing, you might experience this too. Again, been using fluoride-free toothpaste for years. I've been drinking again purified water, and again, I go to the dentist, a biological dentist regularly, which is another
Yeah,
topic. But
yeah.
again, I don't. It's not like I get cavities. Like again, it's been a long time since I've had a cavity. So for those that say you need fluoride to
That
prevent the formation of cavities, again, that's not true either. So
rubbish. Maybe stop eating so much sugar and stuff. And because
exactly.
if you want to have fluoride, put it in your own water. Like, but why
There
mass
you go.
medicate the entire population and destroy everybody's brains and thyroids and things? No,
Yeah.
yeah, just an absolute. But that's governments for you. We won't go there. Dr. Eric, we've covered a lot of ground, and I think, there's probably more that we could discuss, like, genetic mutations that maybe predispose you to having thyroid issues. Can we just touch on that and then we'll wrap it up? What's your take on it? Is there any specific genes that you can look out for in DNA testing, for example, that you go, okay, oh, you've got some bad detox genes, for example, your GST family or something like that. Is there anything on your radar that you know of to look for?
Yeah, it's a great question. And I will admit that's one area where I probably need to improve, like as far as, doing more genetic testing. I mean, I've done it on my own. I've done genetic testing and I have the homozygous MTHFR
Yeah.
C677T. And so
Yep.
I do look to see if someone has like elevated homocysteine, which I did,
Yep.
and that could be an indication of problems with methylation, which is a
Totally.
part of phase 2 detoxification. And but I can't say that I have everybody do genetic testing. I mean, as far as being predisposed to like Graves or Hashimoto's, to me it doesn't make a difference because same thing with celiac disease. Like I don't look at the HLA markers for celiac. I just, I'll test, I mentioned, to see if someone has celiac, but just because someone has the genetics doesn't mean they're going to develop the condition in the first place. So usually I don't look at the HLA genetics. But as far as there could be some value with looking at other genes like that affect like detoxification, for example.
Yep.
Again, that's probably where I have to do more in that area with the genetic testing. Do you
Yeah, I do.
recommend
Yeah,
genetic
I do
testing to
genetic
everybody?
testing. Yeah, I've been doing genetic
Yeah.
testing for years, and I'm a big fan of it. I think it's the most valuable test that you can do because it doesn't degrade over time, right? It's something that you can put in your library and do once, or yes, different companies have show different genes. So, but you've got that for life then because that's not changing, and that's the beautiful thing with it's a good investment in knowing at least a group of your genes that we know what to do with. So a lot of genes we don't quite know what to do with yet, but there are hundreds of genes now that we can assess and make some good recommendations based on those. And genetics is not like it pulls the trigger, but it does load the gun. So you
Mhm.
can look at
Yeah.
it. I like to look at it as a lens that I look through along with other, testing, lab testing, blood testing, and microbiome or whatever the case may be for that person. And it's just another layer that I look in. I do remember I was listening to Paul Robinson. Have you come across Paul Robinson? He's a thyroid expert from the UK who solved his own Hashimoto's journey. Look him up. He's fabulous, and he's written a couple of books too. And there was a gene that he mentioned, and I can't remember it off the top of my head now. And he had two copies of this gene, or two two mutations in these genes that made him much more susceptible. And for the life of me, I can't remember the name of the gene, which is really helpful. But maybe look up Paul Robinson. You might find that story there, because those two genes were specific ones that he tested for and found whether people were, likely to develop diseases based on that. And in his case, he had two mutations in this, and that's why he had such a bad case of Hashimoto's. A
Yeah,
very
I'll definitely check that out.
Yeah, so I'm giving you a couple of research projects now. Dr. Day Goodenow and Dr. Paul Robinson. But yeah, very fascinating people. You've written 3 books. Tell us what your 3 books are, and you've also got a 6-step guide that you're giving away for free, which I highly recommend everyone go and download. Where can people find that guide, and what are the names of your books if people want to do a deeper dive into your work?
Yeah, so the 6 steps guide, they could visit naturalendocrinesolutions.com
Mm-hmm.
to get that 6 steps guide. Also have a newsletter, Healthy Gut, Healthy Thyroid, which they could find that by visiting
Mm-hmm.
savemythyroid.com/newsletter.
Mm-hmm.
And then as far as the book, so I have my first book, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease. It's in its 3rd edition,
Wow.
which was released the 3rd edition in 2023. Hashimoto's Triggers, which was released in 2018, a very comprehensive book on finding and removing the triggers associated with Hashimoto's. It's like 500 plus pages. Now, you don't have to
Wow.
read it from front to cover. You could kind of jump around. I've designed it where it's easy to to dive into the chapters that you find more interesting. But and then the Hyperthyroid Healing Diet is my most recent book, and that's from 2000. That's 2024. From
Wow.
last year, and so that talks specifically about some of the different diet options, some of the different food options when it comes to hyperthyroidism, not just like what you should and shouldn't eat. It certainly covers that, but also talks about things like oxalates and histamine and FOD, like low FODMAPs. Well, again, it really goes into great detail with the different aspects related to diet.
Wow, fantastic. And congratulations on getting 3 books out. I don't know what that's like trying to do that. So it's a lot of work and a lot of effort. And, are you also working with people one-on-one if people wanted to reach out to you, or are you too many people and can't take on any more at the moment?
I do. I mean, yeah, we are limited in what we could see, what I could see one-on-one, just like any
Yeah.
practitioner, there's only
Yeah, you're one
so many
person. I
people you
know the
could
problem.
see one-on-one. Exactly. So it might be a little bit before someone could get in to see me, but it's not going to be like a 6-month wait. So yeah, so they could definitely contact our
Reach out.
office. If they visit one of my websites, there's the contact information, the email or phone number where they could get in touch and inquire about working with me.
And you've got a fabulous podcast, and I'm going to be a guest on your podcast in a few days, which is really exciting for me. So thank you for that. And what's the name of your podcast, and is it on all the platforms and so on?
Yes. So my podcast is called Save My Thyroid. And yeah, very excited to have you on as a guest. Maybe we'll talk a little bit about the genetics that because like, since you do some genetic testing or do a lot, it sounds like a good amount of genetic testing. So yeah, I'm sure we're going to cover, just
Oh,
like
we'll
we've
go
covered a lot of
everywhere.
different things. We're going to cover a bunch of different things too. So again, really excited to continue our conversation in a few days. But yeah, Save My Thyroid, you can find in all the major podcast platforms, or you could just visit savemythyroid.com.
Perfect. That's absolutely wonderful. Dr. Eric, thank you for your wisdom and your insights and your incredible research. We really appreciate you helping us out today with understanding this very complex area. So it's been really exciting to have you on. Thank you so much.
Thank you so much, Lisa. Again, appreciate you having me.
Thanks so much for watching, and we hope you enjoyed this video. Please like, comment, hit the notification bell and subscribe, and of course share it with just one person who you think could really benefit from this content. Click here to watch last week's episode, and click here for my website, and click here to watch a video you may not have seen yet.